Okay, in an examination with 13 different cases, it's quite possible that you may get a case with a patient that asks about something that you're less familiar with, or the diagnosis is something that's less common. And sometimes there are cases that are actually designed to see how do you deal with medical uncertainty, how do you deal with complex things that you're only going to see once in a blue moon, or that are beyond what we can deal with in general practice. So it's really important that if you do have something like that, that you recognize your limits, that you can admit to the patient that this isn't something that I'm familiar with, but I can see it's really important to you. So I'm going to check with someone, I'm going to find out, I can look it up. But equally, sometimes you have a case that it feels in your mind that it didn't go well. Well, first of all, you never know until the marks come out. You might have done better than you thought, so don't give up hope. But equally, if you have a case that doesn't really go well, and there are some cases that genuinely, you think, oh, that was a real disaster, it's okay. You can compensate a case that you did less well in by doing really well in some others. So it's really important to just deal with one case at a time. And you had a bad case, as soon as the case is finished, clear your mind, take a deep breath, start reading the notes for the next one, think about your structure, and then when there's a knock on the door, open the door, big smile, hi, my name's Dr. Rahman, I'm one of the GPs here, nice to see you. Bring the patient in. As far as the examiner that's just walked in knows, you've just scored 9 out of 9 in the last case. If you are busy beating yourself up, or you can't let go of a case that you feel has gone badly, what it can do is go on and affect your state of mind for the next 3 or 4 cases, and just drag down your mark by a couple of marks in 4 or 5 cases, having a much bigger impact than if you'd got no marks at all in that case, but had a positive attitude for the other ones. So just remember, just deal with one case at a time, and no one can learn everything in general practice. It's the nature of general practice. It's okay to have things that are beyond the limits of your knowledge, acknowledge it, be open about it, but show that you're going to be helpful, that you're going to find out, you're going to go and talk to someone, you're going to look it up. That's okay. It's something that we have to deal with. It's one of the beautiful things about general practice, that every clinic that I do, I still see something. I see a patient, I think, oh, that's something interesting, or I've got to look that up, or, one minute you could see someone who's 100, the next minute you could see a young baby, and, none of us can learn all of it. So it's okay not to know something, as long as you acknowledge the limits of your knowledge, sure you're going to find out. And if you have a case that doesn't seem to go well, don't worry about it, take a deep breath, positive attitude for the next one, big smile, and crack on. So I hope that's useful, and we're posting some more tips soon. Thank you.